Welcome back to the Micromolar Podcast Health and Wellness Series.
Today, we're tackling a topic that affects millions, especially as the seasons change: nasal allergies and the best ways to treat them.
Exactly. It all starts when our immune system gets a little overzealous, overreacting to harmless things like pollen, dust, or pet dander.
That's right. When you breathe in an allergen, it activates mast cells in your nasal lining. These cells then release a flood of chemicals, most notably histamine.
And histamine is the big player here. It's what causes the itching, the sneezing, and that constant runny nose by making your blood vessels leaky.
Which is why the first thing most people reach for is an antihistamine. They work by blocking histamine from attaching to its receptors.
They're very effective for that dripping and sneezing, but they can have a downside, right?
Yes, nasal dryness, because histamine also helps with normal fluid secretion. Blocking it can dry out your nasal passages. This can make mucus feel thicker and ironically make you feel even more congested.
That makes sense. And that feeling of congestion isn't really from the mucus itself, but from swelling. The blood vessels in the nose become engorged and narrow the airway.
Right. And since antihistamines don't target that swelling, they often give incomplete relief for congestion. That's where decongestants come in.
Decongestants work by constricting those blood vessels, which directly reduces the swelling and opens things up. But they come with their own set of rules.
They do. Nasal sprays act fast, but shouldn't be used for more than a few days to avoid rebound congestion, where you end up more stuffy than before. And oral decongestants can have systemic effects like raising blood pressure.
So for long-term control, we need to look at another category: steroid nasal sprays like fluticasone.
Exactly. These are considered the most effective long-term treatment. They don't just mask symptoms. They reduce the underlying inflammation that causes both the congestion and the mucus production.
The key here is consistency. They don't provide that instant relief you get from a decongestant spray, but with regular daily use, they offer significant and sustained improvement.
So to sum it up, antihistamines are great for itching and sneezing. Decongestants are a short-term fix for stuffiness, but for lasting relief from nasal allergy congestion, steroid nasal sprays are the gold standard.
A fantastic summary. Thanks for tuning into the Micromolar Podcast. We'll see you next time.